Well, you know, I campaigned in 2008 on making sure that folks have access to health care and making sure that we reduce costs. And we wanted to reform health care, and those folks who still today even remain opposed to the bill that is now law have suggested that the system needed to be reformed. We needed to do it in a way that didn't explode our deficits, that reduced costs, and went robustly after the fraud, waste, and abuse that is in the system. You know, is the version, the final law, everything that I wanted to know? I would have liked to have seen a little bit more, but in the long run, we had to start somewhere. And protecting families from some of the most abusive practices of the insurance industry, like you know, being denied coverage because you have a pre-existing condition, even though you're in between jobs, finding yourself being dumped with your insurance, your health insurance, even though you've paid your premiums, paid them on time, ending those abusive practices, and ending certainly the discrimination that females have in the workforce. Right now, they're discriminated. There's gender discrimination in premiums that they pay because of some of the conditions, you know, that they have from childbirth, etc. So making sure we ended the most abusive practices in the insurance industry, making sure that the American people had access to the very same health care insurance that we enjoy as members of Congress, and lowering our deficit by $1.3 trillion and going after fraud, waste, and abuse was enough for me to support the final version. And you know, my opponent has campaigned on repeal of this, and I asked him, number one, why doesn't he want the American people to have the very same health care insurance that he would enjoy as a member of Congress? Number two, what parts are you going to repeal? The section that deals with denying folks like Jay Hawkins, a 10-year-old boy, autistic boy in our congressional district, who now will be able to buy health care insurance down the road and won't be denied because he has a pre-existing condition he was born with, like autism? Or are you going to repeal the section that prevents people from being dumped off their insurance even though they've paid the premiums? Like the Nicodemo family in North Canton, who found her sister, Mrs. Nicodemo, found her sister with a pre-existing condition like diabetes, and her husband lost his job. She was paying her health care insurance, then he passed away. She was on her own and could not get treatments, could not get coverage because she couldn't afford it because she had a pre-existing condition, ended up passing away herself, and that is an extremely tragic situation. So we don't want folks to have to suffer and struggle in this country when we spend $2.5 trillion on the delivery of health care, more than any industrialized country in the world. And I have been very clear about my position on this, is that we've saved $1.3 trillion. We're helping families like Natoma Campfield, who her situation took me back to a place that I hadn't been in a long, long time. The week before the vote, the president was speaking in Cleveland, and talked about a woman from my congressional district who I had no previous contact with, but was in the Cleveland clinic fighting for her life. And it brought me back to a point in time as a young boy where I remember standing at my mother's hospital bed, and she told us three boys that she had cancer, breast cancer, and that she didn't know if she was going to make it, and she didn't know what entailed the procedure. And you know, I wonder how my life would have been changed, how it would have been different, you know, had my mom not had good health care insurance. Would she be alive today? Would she have been able to get the treatments and the therapy that she was able to? Would I have been able to go to college? What kind of hardships economically would have been in place for us? But she's alive today because she had good health care insurance. And you know, in this job, if I can save one family, if I can save one life, this job's worth it.
And to be honest with you, just about everything I read, I did not like. My biggest problems with the health care bill is that I find it unconstitutional and unconscionable of the federal government to mandate that Americans buy any goods or service. So just from the outset, with the way that that bill is written, the way that it empowers the IRS to enforce this legislation, I have very big problems with the health care legislation that was recently passed. My alternative solution to the problem would be, I would like to see insurance companies as well as medical providers, physicians, be able to practice across state lines. I believe that that would open up competitive fields for not only insurance but for the practitioners, and that competition will result in better quality insurance at a lower cost to the consumer.
Well, what really surprised me is that we have now passed a bill that did not take care of 85% of the problem, which is cost. We passed a bill where 15%, the problem with healthcare today, and we do need healthcare reform, is that 85% of the problem was cost, 15% of the problem was coverage. We took care of coverage, but we didn't take care of cost. And so now what we have, and as I travel the district and talk to companies, we have businesses who healthcare renewals, I've heard everything from a low of 31 to 32% to a high of 63% renewals, because insurance companies now have to do actuarial studies as to the effect of this healthcare bill. So when one of our problems, we've said, we have one of the greatest healthcare systems in the world from the standpoint of we have people coming from other healthcare in the world. We have people coming from other countries to get access to our healthcare. But we have to get our costs down, and we haven't done that. So that bill actually has increased cost to the employer, and now we have employers who, again, it gets back to certainty and predictability. If your costs are going up, and that's less dollars for you to spend, how do you employ more people?